All right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So let's tell them what's on the agenda for today, Heather.
Today we have with us Catherine Van Tassel, who is currently the Director of Behavioral Health Consulting at GBS Benefits, which is out of Salt Lake City, and who I had the pleasure of working with for several years. She's been with them just over 3 years. But her background expands into, let's see, she is a licensed clinical social worker. She is an American College of Lifestyle Medicine diplomat and an NASM certified personal trainer. So she has been around the clinical world quite a bit. Behavioral health is kind of her thing, mental health, all of that kind of stuff. And with GBS, what she does is works with their clients who are interested in bringing on mental health and behavioral health type programs and products for their employees and consults on the,
Oh, cool.
yeah, she consults on that. So, yeah.
All right. I don't think we've done a mental health one in a little while, so it'd be good to get back into that space here.
And not from this perspective. So,
And never from this perspective. Okay, cool. Well, let's get into it. Without further ado, here's our conversation with Catherine Van Tassel from GBS.
hi, and welcome to the Healthcare Uprising podcast. Today we have with us Catherine Van Tassel, the Director of Behavioral Health Consulting with GBS. Welcome to the show, Catherine.
Thanks for having me.
Great. So, Catherine is our resident expert on behavioral health, mental health in the benefits space. So, GBS is essentially a brokerage. And Catherine and I got connected through a previous employer of mine, Levitt Group, who GBS is a part of. So, thanks, Haley, for connecting me and Catherine and having you on the show. And so today we're going to just quickly kind of high level cover some of the things around mental health benefits, behavioral health programs, et cetera, that employers offer. And that's really where Catherine's expertise sits. So with that, what can you tell us, like, as it comes to employers, since that's really where you're focused? Like, why do we need them? How has it changed? What's improved? Really, like, what are some of the best ones you've seen on the market? So just kind of high level to really get a good idea of kind of the purpose of them and what they aim to achieve and how do they benefit people?
Yeah, absolutely. I think a good way to look at it is all the opportunities that an employer may have in their workplace to address mental health. And really nice because when you look at that way, there are low cost, lower load strategies that you can take, and then also integrating with a mental health solution like a paid program, a third party vendor. And high level there, I always say one of the best things that you can do just initially is starting with the top down, meaning that C-suite, HR, leadership, anyone that's in a people leader position is trained in some sort of mental health um, like leadership training. So think mental health first aid and also suicide prevention. We really have to think about suicide as well in the workplace because there are many factors in the workplace that can lead to suicidal ideation. And of course, it's not something we want to have happen. So we can do trainings for leadership, people leaders. What do our policies look like? Internally, what is our access to mental health? So whether that's through the medical plan or then these mental health solutions that you're asking about specifically. So there are many on the market. And actually, during right around the end of the pandemic, maybe last quarter or last third to the end, I had been talking to somebody in that space and they said about 1,000 mental health solutions will come onto the market each year for employers. And I thought, how
Wow.
overwhelming is that for an employer? Like, where do you even start if there are
Hmm.
that many different options out there? It's really difficult. So that's really great when somebody works with their broker or somebody that's in that space to help delineate, like, what is a good option for me? Like, what is our industry? We know construction struggles with opioid use disorder, substance use
Mm,
disorder, mental health, suicide. Um, when you think about entertainment industry or hospitality, very high rates of substance use disorder. So that would be okay. We want to get a solution that has a good carve out would be maybe a word to use, but has a good internal solution wrapped up to do assessments for substance use disorder and then appropriate resources. So, just thinking about a couple of options out there to give concrete examples, we have solutions like Spring Health and Headspace. Headspace actually teamed up
mm.
with Ginger, which was a program that came out of MIT.
Ginger?
Headspace, yeah,
Oh, I haven't heard of that one.
yeah. See, there's 1,000, so you have to
There's
keep
so
up with
many,
them
and I thought
all.
I knew.
Yeah. Yeah. And like CureLink, Uliance, I could go on and on and on. But essentially, if you want the Cliff Notes version, or just kind of like the cheat sheet of what you want to be looking for, think about how quickly do people access care? What is the way people access care? So, can they do it through an app? Can they do it on a desktop? Can they speak to somebody, do that online? Are they able to filter through different therapists? Because might want to see a male and not a female. Somebody maybe want to see somebody with their ethnic background. Maybe they need to see them in the morning, in the evening. Essentially, we know people with mental health conditions get better as long as we reduce the barriers into getting help, and then we don't have long wait times. So, okay, how do people access care? Who are the people that are going to be treating them? Do we have good access and quick access to care? Is there some functional ability for people to choose a therapist, and if it's not a good fit, get a new therapist? And then subspecialty. What does this industry look like? What are the special needs that we have? And then does that platform support it?
Yeah. Every industry, like all industries are not made the same, right? So, and
Mm-mm.
I feel like this comes up to Jeremy. This is probably like ringing some bells. Like we've talked about this, and you even mentioned like construction, hospitality. We've done a series on ketamine therapy with a company called Enthea. Actually, Haley also connected me with them in doing ketamine therapy, highly prevalent industries like construction. They're getting in with like labor unions. So, like, and not all mental health apps and programs are the same, right? So they kind
Yeah.
of can have niche focus areas, I would imagine. I mean, I don't know all the ins and outs, but
It That's just 1,000 a year. Like how do you keep up with that? Like how do you know like what works for who? And like it almost seems like too much abundance going on there.
yeah.
Yeah. Yeah. I mean, that's my full-time job almost.
You're
Yeah.
like,
Is
keep on coming with those products. You'll keep me employed.
Yeah, that's a never-ending work. That's good, job security. Your job's never going to go away if they keep coming out with 1,000 new things for you to check out every year.
Yeah.
The thing that I have to say about them is not all of them are good.
Mm,
And I think all of them have good intention. I believe that. But I think some of them try to be a little bit too niche. And the problem with being too niche is that if you bring in this product, then it's only going to speak to a fraction of your workplace. So I like solutions that have clinical and subclinical skills. So this may be another little tip when you're looking at a mental health solution is, okay, we talked about therapy, high level what you're looking for, but do they also have support for everybody in the workplace? Thinking meditations, maybe movement, opportunities. So like you can go and do a 30-minute chair yoga or even cardio, again, speaking to everybody there. Do they have self-guided DBT or CBT exercises, sleep stories, thinking about all these different things that you can help. Also in the way that we live our life. How are we eating? How are we moving? How are we stressing our community? Having support there. And many of the good ones do.
do you think, and so there's a lot of stuff out there, and maybe this is Thinking more in terms of like use of these types of programs, from your perspective, has there been a growing increase in the utilization of them by the employees? Like the employers make the decision, find, the right programs and whatnot. They implement them into place. They make, they offer them to their people. Are you seeing a higher utilization? Are we do people just not know what to do sometimes? I feel like a lot of people are confused about what their benefits are, about like, how do I use it? Is this actually for me? Or there's like apprehension or fear. Do you see that a lot?
Yeah, that's such a great question because there's so many factors within that. I mean, just one is how is the employer speaking to their employees about it and like constantly reminding them. And this is something I always talk to employers about is you have to remember how the brain operates. So essentially when we become stressed, overwhelmed, burned out, or have an untreated mental health condition, two parts of our brain downregulate. We go into that stressed fight or freeze response. And our frontal lobe, where we make good executive thinking, that's not working as well. And also in the back of our brain, our hippocampus, that's where we retain memory. That also kind of goes to sleep while we're in this stressed state. So the employer may have said a million times, hey, we have this EAP or we have Spring or Headspace or you name it. But at that moment, it's just like it's gone. Like there's nobody there in that part of the brain to bring that back. So the more times you talk about it, this is when I talk about having mental health champions, having a mental health Slack or Teams channel, having constant reminders is really helpful. The other part, and coming back to when I was saying, talking about training leadership, or having these mental health champions that have taken mental health first aid and can recognize common signs of mental health or stress or burnout, they can almost be this proxy frontal lobe. Hey, you seem really, really stressed. Have you called X solution? Because everything's really overwhelming. I mean, just think about if you've been underslept and overworked and have too many things to do. It's like one small thing that would normally be no big deal would just be completely overwhelming or just like, I cannot do one more thing. So that person can be like, hey, let's just call and make an appointment for you to get in and talk to somebody. So thinking about having these types of initiatives, groups, plans, special interest groups within the workplace, this all can help drive utilization because we know with like a basic EAP, maybe think about a free EAP through disability, we are getting like 1 to 4%. But if you have a more robust, then we see like 10, 14, maybe 20. And then again, we see that's industry specific as well.
Hmm. That's I've used EAP before, but there's been, you know,
But EAP,
oh, what is EAP?
what does that
Oh, do
mean?
you want to? Oh,
Oh,
em,
you're asking
empl
me what is an EAP?
yeah, just to
Yeah.
spell it out for
Yeah.
those of us who don't
Employee
know.
assistance program.
Employee assistance program. Okay.
Yeah, like every benefit it changes, right? Like I've had it's typical, I feel like 6 free sessions. And at least in the past that was like in person, but now I'm sure it again, I haven't used EAP in a long time. I probably could have used it quite honestly. Now I'm thinking, shoot, somebody should really encourage me to get some therapy. And also
Mhm.
I should probably encourage my people, that are on my team. And I love that actually as that's such a great leadership tip, honestly, for me as a manager of people to because I do have a full-time job. um, yeah, the podcast isn't, it isn't my moneymaker. But
Thanks.
it is my joy maker. um,
I love that.
yeah, that's my therapy. I hang out with Jeremy and talk to really cool people.
It's a
um,
kind of therapy in itself.
it is, but like that's such a great idea though for me to think about like I should be more aware as a people manager what our
Mhm.
benefits are so that if I see somebody on my team like stressing out because I can tell you my boss has definitely seen me like, you know, hitting a wall. And
Mhm.
if somebody had said, you should maybe think about, doing this or like we have the Calm app, like maybe go take a minute and, sometimes you need that push from the person that you report to, because then it's validating, right? Like they're saying it's okay, you
Hmm.
know?
And meditation in the workplace. You did mention that, and now you mentioned it again. So
Hmm.
I'll bring it up too. Meditation in the workplace can be a wonderful thing, and
Yeah.
really bring down those stress levels and enhance the cooperation amongst coworkers and all kinds of stuff. Can do
Yeah.
wonderful things.
Yeah. I'm all
My
Exactly.
two
for
And
cents
this
anyway.
is Yeah, this is where education becomes so critical. Like, how are we getting this messaging across? Not even that we have this resource, but also what happens to your brain when you meditate. I mean, I have an hour presentation on that. We clearly don't
Oh
have
well.
time to go into that. But thinking about, okay, if I'm an employer, I want somebody to not be, again, in this fight, flight, or freeze. I want them to not have foggy thinking or distracted or difficulty with concentration, which happens when we're in that response. And we know meditation, you're thinking about in minutes, like if you were to do box breathing, which they teach Navy SEALs, you go into that relaxed state, you're more focused, you can think clearly, be more productive. If it were me, I would want to give that to all my employees. But you don't know what you don't know, right? I mean, a lot of people are, how am I gonna buy groceries this week and pay my bills? And I don't have somebody to watch my kids, or, I mean, there's so much going on for people that we have to be there to help them as well.
Yeah. Yeah, that's I like this message of, well, one, we have to do a better job of being conscientious about what kind of plans, what kind of benefits, what kind of programs that we have available, like as individuals. Um, and then the employers themselves, right, have to really communicate that out, like remind people. I love the idea of the Slack channel, like a mental health Slack channel. And then just kind of the ownership as a people manager to ensure that your people are like remembering that they have access to this sort of thing, because if we're all breathing a little bit easier, right, and doing meditation and that sort of thing, or getting therapy, whatever that looks like, then we're more productive, we're happier people, both at home, at work, you know,
Mhm.
in all the
Exactly.
places. Okay.
Yeah.
I love that. um so I'm gonna kind of move into kind of our second part of this discussion here. This is my official segue for the record,
Perfect.
um, because I think we've really kind of set up the what are we here to talk about, right? Today is really about what do you do on behalf of GBS and in terms of mental health and behavioral health benefits, working with employers, consulting with them to say, this is what I think is makes sense for you, right? Like based on the industry, based on, I'm sure there's a lot of factors, but you obviously have a lot of clinical expertise in this space, and you and I have chatted a little bit before. So I have a little bit of your background, but like what actually brought you into this role? Like what was kind of that pathway for you and that kind of clinical expertise that you bring to making these kinds of I guess recommendations.
Absolutely. So it's a bit of a long story, so we're going to shorten it so nobody falls asleep during your podcast. But the abbreviated story, so my background, I'm a licensed clinical social worker and a physician assistant. And I love mental health. I've been in mental health for more than 20 years now. But what I love the most is preventative health care through lifestyle. So I went back and got a board certification, a subspecialty from the American College of Lifestyle Medicine, essentially using allopathic medication. Well, allopathic means just our typical, like if you were to go to a doctor and get medication. So using evidence-based there, but in conjunction with six pillars of health. So how we sleep, how we stress, how we eat, how we move, cessation of risky substances, and our community. Because we know, for example, there are studies that have been done that show if somebody is moving their body, that can help improve their depression the same, if not more, than medications. Now, I always want to put a big asterisk towards that. I prescribe medications. Medications are life-saving. This is not to demonize medications. It's to highlight how important it is that we need more tools because medications aren't perfect and they also have side effects, and not everybody feels 100%. So, thinking about using all the tools that we have available, we see people really thrive, and that's so important. So I've worked inpatient in the hospital for the University of Utah and outpatient, and I got this. I was working inpatient in the hospital. I love that job. Probably would have never left that job, but I got this incredible opportunity to become a master trainer for iFit. It's the company that makes Nordic Track. Essentially, it
Oh,
meant that I got to travel all over the world, and write the mental health uh, programming for workouts. So think if you were on your treadmill or if you were on a rower, there would be maybe an Olympic athlete talking about mental health, and I wrote all the back end. And then I was there when we were running on a trail in Greece. Like I lived in Greece for a month.
wow.
Nice.
That
That's
sounds
a
like
dream
a
job.
really cool job.
Yeah.
That's crazy. I love it.
Probably the only thing that would have taken me from the U. And it was fun. It was amazing. But post-pandemic fitness, connected fitness, really took a nosedive. And so unfortunately I was part of a rift there, and they laid off like the majority of their of their workforce. So that
Mm,
job evaporated. But I don't know. I always think like when something ends, something better begins. And that really happened because that's how I got my job at GBS. And I thought, gosh, this is such an amazing space because prevention is so close to my heart. Thinking about what can we be doing in the workplace? What is the research saying? How can I help people um, that spend 40, 50, 60 hours a week at work? That's way more time than I can spend with somebody in clinic, helping leadership. And then you increase everybody's happiness, including employers who get better outcomes. Thinking about medical plan spend. I mean, there's just all of these things that really we have a lot of impact on, but I don't think maybe we realize it or it feels overwhelming. So I've been at GBS for 3 years. I still work one day in clinic, to keep my skills and stay
Mhm.
relative, and I love still practicing medicine. But the marriage of these two has just been such a fantastic opportunity.
That's awesome. I've worked with a number of people over the years, who are, they have like administrative kind of clinical type jobs, like when I was at Aetna, but many of them
Yeah.
would still go back and make sure, like there was a chief medical officer that I worked with one of the joint venture health plans, and he would work one weekend a month in the ER because he said it kept him um like in like on the front lines, right? Like so that he wasn't making decisions in this vacuum of like no longer knowing what was happening actually out there in the world and not making decisions on behalf of the health plan that was like impacting so many lives and not being able to speak from like that firsthand experience. And I love that when I hear that you're still out there and actually still practicing. So I think that's so important. And as people change and the world kind of evolves and I don't know, people's needs change and
Yeah.
how they want to get access to mental health or what does that look like, right?
Exactly. And at GBS, so to answer that specific question, that's been really fun because I kind of got to create part of this role. There was a psychiatrist that was working part-time but doing a lot of we do these beautiful clinical insight reports, which we have a pharmacist that has their own. Then we have our medical director does their own. And then for me, I have one that I'll sit down once a year with our clients and we can see overall picture of what mental health spend has been. So anxiety, depression, ADHD, bipolar, substance use disorder, and dive deep into each of those. So I do that now, but also just big picture advising. So, um, policies, procedures, outside solutions, third party vendors, and then I do a lot of training. So I train mental health first aid. I'm also certified to train Vital Cog, which is suicide prevention in the workplace. And then I have a whole list of seminars, which are like how we sleep impacts our mental health and fueling your brain with the food you eat and community. We know community people that are disconnected or higher rates of mental health, also stroke, heart attack, diabetes. So that is so fun for me to go into the workplace and deliver these either in person or webinars or train leadership in mental health first aid because it just brings so much awareness and so many people are like, I had no idea that if I wasn't sleeping 7 to 8 hours a night, this whole there's all of these negative outcomes from that. So what does that mean in the workplace? If people don't have a good work-life balance, you know, that's impacting your bottom line.
Hmm.
Can you expound a little on the concept of mental health first aid?
Thank you, Jeremy. I knew you were going to ask, and I was hoping.
I feel like I might kind of know what that means, but I would love to hear what you have to say about that.
Yeah, that's a great question. So we have CPR, right? If somebody were to become unconscious, we train people in first aid, CPR, what that looks like. But historically, really, we haven't talked about mental health crisis or somebody with a worsening mental health condition. So, Mental Health First Aid is an organization that has a training, and somebody has to become certified to do it. But essentially, the training is a full day training, and it is not for clinicians. This is for leadership, employees. It's for anybody in the public, really, could take it. How to recognize common mental health conditions, how to speak to them. Um, how to appropriately give people recommendations. So they talk about self-care. So everything from sleep to groups to community, all the things that we talked about, and then professional resources. It's not to train somebody to be a clinician. I always say this to anybody that comes to my training. This isn't getting a new job. You don't have to manage this at your workplace. It's just recognize it, feeling comfortable speaking to it, and giving them appropriate resources.
That's cool. I've been a taxi driver for 15 years. I feel like I should take that class.
That does
Yes.
make sense.
I get people in some states sometimes, let me tell you.
Oh, I can only imagine.
Oh, yeah, that's true though. Uber and Lyft.
Yeah.
Pay
Well, that's what
attention.
they call it now. I've been doing it so long, I still call myself a taxi driver. I still spent more years in a taxi than I have with an Uber sticker on my windshield. So,
Professional driver over here and maybe part-time therapist.
Yes.
which
You
is why I
probably
have to
already
start
have
a
a lot of
healthcare
skills.
Okay.
podcast.
Yeah, that's why you're
So I
a
can start
healthcare.
learning about why I'm so broken.
That's so funny. Okay, thank you for explaining that. That's interesting. So if if so if a client of GBS has the desire for something like this, they would bring you on site to conduct this kind of training.
Yeah, so I can do it in person or virtual.
Is this normal?
It's just like the CPR classes, but
Yeah.
it's meant but mental health first aid.
I love it.
It makes a lot of sense actually.
I've never heard of this before, and I've worked for a lot of different companies. So I'm like, is this pretty standard or is this something pretty special that
It
GBS
sounds
does?
new. It sounds like a new thing.
Yeah.
Yeah, I will say, and I mean, I'm not biased because I love GBS, which I do. But they really have kind of gone above and beyond at looking at what is needed in the workplace. And that's really how I have my job because so many people were talking about mental health in the workplace. They knew that there was a space that needed to be filled. And so I work along with our wellness team. So wellness in the workplace has been around for a long time. But there was a specific need for mental health. So that was really fun because I got to kind of create my job. I got to look at all of the evidence that was out there. What are people doing? We're seeing more and more research being done. Um, and and also talk to employers. What are they struggling with? What don't they know, how to handle? And that has been eye-opening because, the thing that I hear overall from HR is, I was used to going over the policy for our leave or our dental benefits. And now I have people coming into my office telling me about domestic violence or
Oh,
suicide
wow.
thoughts that they have. Um, and I don't know what to say. I'm not equipped to do that, to work with that. What do I do? And so this has just been something that I hear. I mean, it's not uncommon now. It's one of the most common things that I hear is that we need more support. More people are asking for mental health in the workplace. I think generationally, it's changing a lot as well. When you think about the arc of people that are working, like the happiness arc, people, as long as they were born in well-adjusted, happy households, you're usually doing pretty good cooking along with your happiness level until you hit about the end of college, starting a job, getting a house payment, having some kids. We see people become really stressed and anxious and their happiness levels go down. But then it gets better as people go into retirement and kids are leaving the house and you have some more security. And then you see it gets better when you retire and, kids are doing their own thing. Not that people aren't happy with young kids, it's just stress, right? A
Yeah.
new mortgage is stress starting out in
Yeah.
your career. Um, and so that's really interesting because that's the bulk of when people are working as well.
Mm.
Um, so I always say this is my first time being human. I'm doing the best that I can. And I think for everybody else, that's until we, are perfect, we need to address brain health. Everybody has a brain. We worry about heart, we worry about lungs, we got to worry about our brain.
Yeah. I was going to ask you like what has changed? And you kind of started speaking to that. It's a generational thing, right? Like as even your, well, what we've got Gen Alpha is my youngest, and then we've got what Gen Z, which I think is my oldest. I'm still trying to
Like
remember all the names. And then
Gen X.
millennials. Oh, we've got, I'm sorry,
So
who did I skip over?
you
But
have a Z and an alpha?
I do.
Interesting.
I know. I know. It's weird.
I
They're
never
like,
I never understand how that works.
I don't know either. But all I know is that I'm Gen X and we're the best generation.
That's all I know too.
Yeah, we're also like kind of to the point of this conversation is that Gen X have always been, very like I can handle this, right? Like independent, we were the latchkey kids, like I don't need any help. I've got this, right? And like we've been kind of bringing up our, in our lives, right? Like I've got this all handled. I feel like the shift, at least generationally for Gen Xers like myself, has been very inspired, quite honestly. And maybe this is just me by the openness and the desire of millennials, which many I am friends with. They are my younger cousins, they are my neighbors, they are even my friends. And I feel like, well, they've like made it okay because they've made this whole mental health thing maybe more than any generation.
Mhm.
And maybe like all the ones that come behind them are going to be even like more elevated. But I feel like millennials were kind of the ones that opened the door and said, you know what? Screw this. Like, let's take care of ourselves. And I'm listening.
Yep.
And so is that like is that just my story or did you kind of see that actually playing out in the universe?
Yeah, this is again, I mean, I think my whole background being in social work is just so interesting to hear this story because what you just said is something I've heard over and over again from HR and leadership.
Hmm.
Um, because very much, I mean, I think about my grandparents. I could give my grandma like some twigs and rocks from outside and she would make the best homemade bread. I mean, this is like Depression era. Like
The
I mean,
silent
I don't even,
generation. Yeah, that's
Yeah.
my
yeah.
mom.
Yeah.
Yeah.
Exactly. And then same thing, my dad's like, pull yourself up by your bootstraps. I mean, I got bucked off by a horse literally and had to get back on.
Hmm.
It was very different mindset. And so a lot of times people will say to me, is it just because we're talking about it more? Well, I think there's nothing in a vacuum, right? Everything's multifactorial. And I think that there are a lot of different challenges that we didn't have a decade, 2 decades ago. I mean, thinking about social media for young minds,
Mm.
that has completely changed, our brains. And we could table that for a second.
It's hard
Also, it's
enough being a kid, right? Like a young person, and then to have social media later on top. Yeah, I can't
I
even
can't even imagine.
it hurts to
Like
just think about it,
MySpace didn't happen until I was in college. I can't even imagine the stuff we got away with, man.
oh,
right?
I know, I know, no
The
videos, no
stuff we
evidence.
did, like we wouldn't have done half the stuff we did if social media was a thing.
Right? There would be
It's
records.
crazy to think about.
Oh man.
Yeah. We know from the research, if children spend more than 2 hours, and thinking children, adolescents, spend more than 2 hours on social media, they're at 50% increased risk for depression. Um, we know females, their brains are disproportionately impacted. It seems like self-esteem, thoughts,
Mm-hmm.
exact I look comparison. That's already heightened for women, even higher we see. Um, and so that's just a portion, let alone feeling left out or not included. I mean, I say this all the time. I'm so thankful I didn't have social media growing up as a kid.
Mm-hmm.
So we see those changes, and those people are coming into the workforce, those teenagers, young adults, but then also how they communicate. We also have the pandemic. Remember where everybody was separated and think about this. If you have somebody who now is in their early 20s, but they were in high school when the pandemic, like their junior and senior year, think about how much you grew as in just socialization skills in your junior and senior year that were completely lost. You didn't get that.
All right.
I mean, we don't even know what that implication is going to be. So you have somebody that's in leadership trying to talk to somebody that maybe has not developed some of these skills, also has a brain that texts. When we text, we have time to edit our thoughts, right? Like you can think about what you're saying versus having this conversation. And I have to have this with my leader and think on the spot, and I don't get a chance to edit that. That can be very anxiety provoking. Things that we were all used to doing. Like that just wasn't something we dealt with. And then you think about like all the other things when we're thinking about the changing mental health landscape is you have two people really that have to work in the house. Before you usually had one parent that could stay home. That was more typical. You need two incomes now. That puts on a different strain. Not that that's bad, but it's just different strain that you have. Um, More difficult to buy a house. There's just a lot of change, which makes sense. So you have a generation that's more open to talk about it. And then many things are different than they were a decade, 2 decades, definitely 3, 4 ago. So it's kind of not surprising, right?
No.
Yeah.
Yeah, I was just gonna say too, like you were talking about teenagers that are now entering the workforce or, early 20s, whatever. And what COVID did, like I saw it with my own son, he's 16. He was in sixth grade during like the main COVID year. And then when
Mhm.
everybody went back to school for like seventh and eighth grade, like there was some serious social delays. Like they didn't know, they legit like did not know how to interact with each other, particularly boys and girls, right? And so I actually even noticed that the kind of the boy and girl interaction was like significantly delayed, I would say, even to like high school, whereas like normally in middle school, you see a lot of that kind of with the hormones and all the things. But it was like they had to like relearn how to act with one another. That was really interesting to see too at that age. And just to see like and you can the impact of that. It's not fixed overnight.
Yeah. It's a crazy butterfly effect where it just
Yeah.
compounds on itself in so many ways that
Hmm.
it's hard to even measure the depth of the change that caused in a whole generation of people, literally a
Yeah.
whole generation of people.
Yeah. That's just, and then to think about how, what are they like going into this next, stage of their life of being in the workforce and the longer I've been in my career, the more younger people I've worked with because I'm becoming a much smaller portion of the pie chart
Hmm.
in
Hmm.
terms of like, when you look at like the age demographics and stuff. And so you really do, you have to evolve.
Yeah.
And it is a thing for me. It's listening to them. It's getting some of my cues from them, from these younger people on how I should be kind of going about, because dealing with a bunch of Gen Xers and probably boomers, right? Like we would all be like the bootstrap people and be like, we'll figure it out, right? Like, nah, there's like no sensitivity whatsoever. And
Well, you started a podcast. That's very millennial. That's a very millennial thing to do.
thank you.
Yeah.
John,
Yeah,
how
sitting here we are
millennial of
talking about
you.
mental health in the workplace.
Oh,
What do you think? I want to ask a question about like what you've seen change. And I know you've only been with GBS for 3 years, but you've been a therapist, you've been in other roles. How how have companies kind of gotten on board with things? Like are there certain industries that are better at understanding and like supporting mental health for their employees than others? do some of them just kind of completely miss the mark and are just like old school? Like I know that there are like certain industries that are just a little behind the times, right? Like they're not the first adopters, we'll say.
Exactly. Yes. The tech world is more forward thinking, I would say, when you're looking at top. Um, I would say municipalities and schools, they really want to be. They're really challenged because their budgets are so challenged and people are quite overworked in those industries. But I also think they see a lot of suffering. And so, and we see that too in the data. I mean, teachers are just struggling
Mm.
so much.
Oh yeah.
Um, so most certainly. And then it can, I mean, so you can see differing between industries. Thinking about um, uh, first responders as well. But then it's
Hmm.
really, this is why I always like circle back to who's in the leadership, what is their messaging, how are they speaking to employees? Because you could have maybe an industry that would typically be more forward thinking, but their leadership is very much not there yet. Pull yourself up by your bootstraps. I worked really hard. You should too. And I just think that's fine. You can have that attitude, but you're hurting yourself because this isn't made up anymore. I mean, you can go to the CDC, you can go, I mean, we have our outgoing Surgeon General had a whole report on mental health in the workplace. Down the line through all of these research institutions, the World Health Organization, all can tell you this is what happens when you don't address people's mental health. You have more turnover, more workplace accidents. So I've been working with one of our groups. They're very forward thinking. They work in an industry that safety is number one, thinking about transportation, dealing with substances that can be toxic. They want to make sure that people's brains are doing well because that means somebody can die if they're overwhelmed, fall asleep, not getting, not having proper care for their brain. So it just really depends who's sitting at the top of that and making the call, and do they see that it impacts their bottom line? Like I was saying, presenteeism, safety, their medical claims, substance use in the workplace. People may be showing up, but they're not actually doing work, turnover. It's all impacted.
Yeah. It's definitely out there. Yeah, it's
Yeah.
amazing how much you spend, I think you even said it, you spend 40, 50, some 60 hours a week at a job. Like you need to be happy and productive and feel good about where you're at. And how miserable of a life is it for somebody to put that much time into a job and and not feel good, right? That's
Yeah. Yeah. I
Yeah, and
just
like you
did this
said,
present. Oh, sorry.
sorry, I didn't mean to cut in there, but it's like you said before, we've heard multiple times in our mental health episodes about the construction industry.
Hmm.
And you think about that life, those guys get injured all the time. They probably have a
Hmm.
lot of pain issues, which what gets them on the opioids to begin with. And we all know where
Hmm.
that leads. But there's also like so much of construction is they send you somewhere for 2 months to build something and you're living in a hotel room. You're away from your family and friends. All you have is your crew. And if you don't like them, you know what I mean? Like, and you're probably not eating good food and you're probably not doing anything but work. And you go to work and you eat dinner and you go to sleep and you get up and you go to work and and I can see how that industry would be a place that creates that kind of mental health. It's almost like it's endemic in the industry with the way the industry works in a
Yeah.
lot of ways. So I mean, it's good that there's people actually focusing on who actually needs this the most. I like that keeps coming up. I just wanted to get that
Yeah.
in there.
I think
yeah.
you're 100% spot on. So, okay, what can in that specific situation, all right, those people leaders that are there with those crews, what can they do? Like, how can we get them moving, not just going to the hotel room, maybe eating this high fatty meal, drinking, and then going to sleep? Okay, let's get people moving. What kind of activities can we do together? We know that community and movement is amazing for our brain. It releases serotonin and dopamine. I mean, there's all of these things that we could talk about. We don't, and this is always what I tell employers. It's not that your job can't get done. It's that you just have to make opportunity for healthy behaviors and support within that.
Yeah.
Well said.
So I want to kind of wrap up this conversation. It's been really great, and I would love for you to maybe leave us with a word of advice, and that is like if you could tell every employer, about mental health in the workplace, how do these programs improve their employees' lives? And even for the employees, right, that might have access to these benefits that their employers are offering to them, which, by the way, I need to do a better job of taking advantage of my own benefits everywhere that I've been. Yeah, I'm a big offender of that as well. So I get it. What would you tell them? Like, what would be your piece of advice? Like, what would you leave everybody with regarding mental health benefits, behavioral health programs that are available?
Yeah, absolutely. I would say don't get overwhelmed. There's a lot that you can do, and that can be very overwhelming. And what happens when we get in those situations, we just end up not doing anything. So take like a little internal temperature. What are you noticing specifically in your industry? Where can you reach out for support? This is not meant for one person to take this all on. And this is also something I talk to HR leadership about all the time is I have a full-time job that's already taking all of my time. How do I take on all these initiatives? So, what resources are out there, and just what is one small step? This is what I tell not only like an employer, but also just us as individual. We all have things that we want to attain, but we just have to take that, like, what is one small step to start building that wall? I mean, you think about a brick wall that didn't get built overnight. It was literally one brick at a time. So think about this as maybe your brick wall of protection, not a barrier. And what's one small thing? And I'm happy to send you. I have a workplace toolkit for mental health in the workplace. I'm happy to send that to you if anybody would like to use that. It's a free resource. And essentially, it can show you by category, like an EAP or policies and procedures or training and leadership, what that looks like. And if that would be helpful for somebody, I'm happy to share that. Some of the resources may be specific to GBS, but in general, it's just a resource, not specific to GBS.
Okay, great.
Cool.
Yeah, that'd be awesome. Yeah, I think the main message is like start somewhere, right?
Yeah.
For no matter if you're an employer
Mhm.
looking at new benefits or if you're the employee who has access to the benefits and you're listening, start somewhere, right? And there's something out there, hopefully, right? There's usually something out there that you can access to help, and it does seem to be that we all can benefit from some kind of mental health support in some way or another, and I'm here for it. I need to do a better job of myself. Although I have to say though, I'm excited. We're doing a series on like holistic health and well-being. I've started doing breath work um, and and sound therapy. We are bringing people on the show to talk about that. I am breath work, by the way, is one of the best things that I have ever done. Um, Talk about meditation. Like if everybody could just do some breathing, like somatic breath work or whatever, any of that stuff.
I love when we come full circle like that.
Yeah,
Yeah.
highly recommend.
Yeah. I
But
would so one just one like you don't know what you don't know, and to put an asterisk on what you just said. There was a study done where they took people who had never meditated before. They had them meditate for 20, I think it's 26 minutes, maybe 26, 27 minutes a day for 8 weeks. Think about that. That's 2 short months. I mean, tomorrow it's going to be Christmas. We know that. Like I'm waiting to go to the store and Christmas trees be out. Um, Meditate every day. They took imaging of their brain before and after to the structure in your brain where we have anxiety, fear, that grew smaller. And the part of our brain where we have empathy, introspection, memory grew bigger in 8 weeks of just breathing.
wow.
I don't have any
Six
medicine
breaths
that
a
can
minute.
do that. Yeah,
That's
I mean, that
amazing.
is just amazing.
I'd
That's
love if we
free.
could. I'd love if we could get you back on to do an entire meditation episode. You said you had a whole hour thing on that. I would love to hear that. Not to
Yeah,
put you on the hook or anything, but
I'm here for it. I love to
We love
spread the
it.
good word.
Well, this has been really enlightening again. Really appreciate you coming on and talking about all the work that you do in this space. And I hope that everyone listening is paying attention because, yeah, this stuff isn't going away. It's only going to, I think, increase in terms of the need and the desire, right? From like both ends, right? From the employers and both the employees, but it's really finding the thing that works for you. So,
Yeah,
a lot of options. So, yeah. Well, thank you so
cool.
much. We appreciate you
Thanks
coming on
so much.
today. This has been a great conversation.
Thanks so much.
Yeah.
and there you go. Our conversation with Catherine Van Tassel from GBS. Very cool stuff. But I'll pass it to you first, Heather. What's our main takeaways from that?
Well, I'm encouraged, quite honestly, that it seems that I guess desire for programs around mental health, behavioral health type of stuff, whether it be in the employer space, employer benefit space or not, is just growing. There seems to be uh, there's an acknowledged demand and need for it. And so people like Catherine and her roles are really important in advising their clients who are employers in getting the right programs and the right products. Because another really interesting takeaway, which wasn't a big surprise to me because I've worked in healthcare and employee benefits for many years. Every industry is different. They have different needs, like hospitality versus construction versus like an engineering firm, and therefore they have different mental health needs that, show up in different ways through the types of products and the programs and the apps and the things, right?
Yeah, 1,000 of them a year. That was a overwhelming piece for me. Was there's so many of these products and
Yeah,
programs and new ones coming out all the time. She said 1,000 of them a year. Like,
that's crazy.
I mean, being able to find somebody who can filter that for you is, I feel like that's definitely a really helpful thing.
Mm-hmm. Yeah. Yeah, that alone, actually, it was an interesting piece of data
Yeah.
that she shared. So, but that I think that also means though that there's a lot of people that are, interested and realize the collective we,
The royal we.
the royal we need something.
Hmm.
So I think it's good for us. There's a lot of people thinking about it.
Yeah.
So
The one thing that struck me in that conversation was she said that after COVID there was actually a big pullback in funding for this mental health stuff that I made a note. What did I say?
mm,
Uh oh yeah, the mental health through fitness aspect that she was working on with all the like biometric wearables and stuff that space she was in.
yeah,
And after COVID, she said there was a huge pullback in that space and a lot of the jobs dried up. And I'm like, shouldn't that have been the other way around? Like, didn't we need more mental health through fitness after COVID than we did before?
that's
But
right. She
we
worked at
reacted in some bad ways to that whole thing.
Fit with the Nordic
Yeah, the
thing.
Nordic track and all that. Yeah. That was the one thing that was said in the episode that I didn't like didn't think to respond to in real time
Mhm.
was
Follow-up question.
yeah, yeah. If we see her again, I gotta remember to ask about that.
Yeah.
But the fact that if we ever needed a mental health through fitness regime in America, it was after COVID, and that's when they pulled back on it.
Mm-hmm.
That was a little counteractive to me, but it's good to see that
Yeah.
people like this with companies like this are still out there trying to make it happen.
Yeah. Yeah, I think so. Employers have a lot of opportunity, especially the bigger they are because
Yeah,
they have big populations of employees, and therefore you can make a big impact. So
yeah.
that's a lot of people's lives.
Yeah.
So, yep. I
Right.
I mean, other than that, like let's just keep this mental health conversation going. I love that we're really starting to dig into this topic from a lot of different angles again. So
Yeah, and we got a few more of these coming up on the schedule too, which is cool. But
we do.
So if you want to keep following us through this mental health journey and maybe, help make us all a little better in the end, make sure to hit all those happy little fun buttons with the likes and subscribes and shares or whatever it may be on whatever platform you're watching or listening on. We are on all the major audio platforms. We're on YouTube if you want to see us on video. We also have video on our Patreon at patreon.com/healthcareuprising, where you can monetarily help the uprising exist. Uh, I'm going to be honest, we don't offer a lot of extra stuff on there. It's really just if you want to throw us some money, join the Patreon. I'm just going to be honest on that. But what else we got to tell them here, Heather?
You can find us online at healthcareuprising.com, but mostly on social media is where we are active. We're on LinkedIn, we're on Facebook, Instagram, and Blue Sky. So we post up there a lot anytime our episodes are dropping and resharing a lot of the posts from people and organizations that come on the show. It's a really great place to kind of keep in touch with what's happening in the healthcare industry. Let's see. We are always looking for people to come on the show. If you have a new product or you're a healthcare startup founder and you're looking for a place to talk about the good you're doing in the world, or if you're a human, I mean, we're all humans, but if
Speak for yourself.
if you're a regular like human on the street and you have a story about your journey through some kind of healthcare experience, good or bad or otherwise, and everything in between, we would love to hear from you. So, love for you to be a part of our human stories series. So, reach out to us at healthcareuprising@gmail.com. Give us a shout, and we'll set up some time to chat.
Awesome.
Yeah. Other than that, I think this is your final dose of what do I say?
We have completed this week's dose.
I need some mental health therapy, quick.
I could use a little myself.
So keep looking for the good in the world. Sometimes it's where you least expect it.
This has been a Shut Up production.
Shut up!